With regards to the number of animals in shelters and people adding animals to shelters, for every single pet in South Africa to have a home, every single person in every single household has to own a minimum of 27 animals. There is not a snowball's chance of that happening, ever. To add to that extraordinary number of homeless animals is, in my opinion, also irresponsible at times. Unless you can find 27 pets at home with your uncle and your aunt and your sister and your brother, at that point you can then maybe judge somebody for putting an animal to sleep.
Welcome back to the Pause and Effect podcast. I'm your host, Dr. Carra, and I have a very special returning guest, Sister Kat. Welcome back, Sister Kat.
Thank you so much for having me again.
Thank you.
Happy to be here.
Yeah, so we had the controversial subject of obesity in our pets and how to have that tough conversation last time we met.
Yes.
But I have an equally difficult subject to tackle with you today, and that is euthanasia.
Yeah.
So the subject of really the time to say goodbye, and how we can best advise our listeners, our owners, our colleagues, all of us to deal with the process.
Yeah.
And I think probably having the conversation is important because maybe there are a few misconceptions.
Absolutely.
And being prepared and sort of knowing what to expect can be part of the process. So I suppose my first question, opening question for you is, how do you advise your owners when it's time to say goodbye, whether it's in an emergency type situation or a situation where something's occurred and the pet is young, or that end stage? How is your sort of approach to these very difficult conversations?
So, as you say, I mean, it is a very difficult conversation to have. It is an emotionally loaded conversation. And at the end of the day, it comes down to what is best for that patient at that time. Also with regards to how that fits into the owner's actual personal life. I mean, that can be anything from finances. Are you going to be able to cope with what sort of conditions the dog or cat is left with after said emergency? Are you prepared? Can you do that? Can you handle it? And if it's end stage as well, you know, that it's the quality of life for animal versus quantity of life, you know, and we need to go down those roads and figure out what's best for said animal. And a lot of the time we need to take personal emotions out of the equation.
It's difficult, isn't it?
It's very, very difficult, but it's necessary.
Absolutely.
And it's a gentle conversation, but, you know, we also need to sort of put some boundaries or at least notify of boundaries that should not be crossed.
I suppose also having an awareness of, I think often owners are not aware because things have been slowly progressive. So if we talk end stage life, let's start with that, because I think that's hopefully what most people hope that they're going to be facing, not the event of an emergency.
Correct.
Or
Yes.
like, you know, from a personal experience I've had to deal with, and that is having to put a dog that doesn't feel old enough to sleep for other reasons.
Yeah.
And I think, you know, that end stage of life sometimes creeps up, and people have been so accommodating with things like their dogs weeing in the bed, or difficulty getting up and helping them up and helping with mobility, or syringe feeding them, for example, that often these are not things people see as reasons potentially to put them to sleep. But that's generally our approach, isn't it, in terms of when we're discussing what are the normal requirements of a comfortable, happy pet, is having those kind of conversations. So let's start with the old pets.
Yeah.
What do you chat about? Is it along those lines? Is it a case of saying, what are your basic expectations for a pet that is having a decent quality of life?
Yes, yeah. So obviously we need to meet all basics, that the pet is able to get nutrition in, maintain its weight, maintain comfortable mobility. And in some cases on that note, like they're not necessarily all going to be able to be fully mobile by themselves, but then is there somebody at home at all times that can help in those situations? You know, if the dog needs help being lifted up but can then walk by itself, you know, are you able to accommodate that for the pet? Because if we've got an immobile patient at home and everyone's gone to work, that's no quality of life for that patient. So, quite a few factors to take into account. But, definitely always quality, absolute quality for the pet. They're getting absolutely everything that they require, pain management, nutrition, all needs met.
Yeah. And I mean, I think, if you've had a pet that's been really interactive all their life, and then suddenly they're really isolating themselves from the family, you've got to see that and have a discussion with owners about what that may mean. It may mean they need some more rest, which is fine, but does this indicate that they're in pain?
It could, absolutely
And,
could.
Yeah, and I think often they're really good at disguising. There's certain breeds or certain animals or pets that are really good at disguising a lot of things and being really stoic. And obviously as advocates for those pets, as in terms of the position that we're in, we have to make owners aware of when we feel unemotionally that they are suffering. That it's time.
Yeah. So any change in behaviour, especially in a senior pet's life, those need to be investigated sooner rather than later. They, as you say, they can be quite incognito about what's going on. You're sort of, he's just sitting quietly in the corner. That dog or cat may have a disease process happening at the moment that could go hugely wrong at any minute. For example, if we've got a splenic tumour and the dog is now sitting off quietly to the side, that dog is at risk of that splenic tumour actually rupturing. So while it might just be looking quiet to you, it's on the verge of something going horrendously wrong, and that can happen in split seconds. So any change of behaviour in these senior guys needs to be investigated as soon as possible. Because it could be something drastically going wrong that you're only seeing minor changes, or that you just think the dog's just being quiet or the cat's just sitting off to its side, not wanting to interact with everyone like it used to. So vitally important, any small behavioural changes, any change in pattern or routine, get seen to immediately.
And I think people are often nervous. I think there are multiple reasons why people perhaps don't come in and see us. And I think, obviously the financial limitations, when they come in, we're often going, can we run some bloods? Can we take some x-rays? And people go like, no. We very much work with the view that we will work with what owners are able to do. There's no judgment. There's no expectation. We will offer those services because we want to be able to try and help. But even if it's a case of just coming and having a discussion, we are open to that and we're comfortable.
Absolutely,
But also because I've had owners comment that they're very worried about being told that it's time and they're not ready.
Yeah, I can understand that. And once again, that's where we need to be brave. You love that pet more than anything else, which is why you're wanting to hang on to it for as long as possible. But you've got to take that love and direct it in the right direction. Is that you've got to be brave, that you've got to be able to make that call and go and hear the news, be it good or bad. Because it doesn't even necessarily mean that it's going to be bad news when you come and see us. It might just be, oh, shame, we've actually diagnosed some severe arthritis and we can manage that. We can work with you. If you're going into great lengths or wanting to go into great lengths, we can refer to a specialist for chemotherapy if it's sort of that it might work or elongate that pet's life. So it's not always going to be bad news.
No.
So but we've got to put the focus on what's best for that pet.
And even
take
if
that
it's,
love and put it towards the pet.
I agree with you. And I think even if it's a case of having the opportunity to then prepare owners, so to say, look, it's you're getting to the point where it's you need to make a decision. You may need some time, so you don't have to do it now. But in order for this pet not to suffer for the next few days, let's talk about how you can support them nutritionally. Pain relief. What you should be doing at home in terms of assisting them, like we said, because if we're saying basic needs met, you don't want them to be in pain. You don't want them to be urinating or defecating in their beds. And you don't want them to be hungry. I mean, those are really fundamental things for us. And like you said, I think historically people, and I hear it still, people hope that the dog or cat's going to just pass away. Do you hear that still? They're going to just, come down one morning or walk into and they're going to find them asleep in
passed away in their sleep.
We don't we don't deal with that much anymore.
No, that's actually a very rare occurrence, that animals just peacefully go to sleep and never wake up again. It is unheard of, actually. There has always generally been an event of sorts, and as traumatic as that is to hear, it is the reality. So the thought that, oh, shame, old Fluffy's just going to go to sleep and just not wake up in the morning is a fallacy. And unfortunately, we need to be aware of that and need to make the right call for the pet, as that is our responsibility in pet ownership.
Absolutely.
Is to give them a dignified end and not let them suffer or go through something horrendous while you're not there with them as well.
Yeah. Welcome back to Just for Pets. You're with Dr. Carra.
Hello, Doctor. It's Chanel the Persian. And, I can't seem to stop retching to get this hairball up.
Are you on a special diet?
Excuse me?
Hairball control food will really help. And maybe some Laxapet. And lucky for you, Just for Pets have a big range.
Well, how early can I get some?
Order today and we'll deliver pronto.
Wow, I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.
Before we continue, let's address a critical aspect of feline health, weight management. Allow me to introduce you to Ultra Pet's special diet, Metabolite Cat Weight Loss Food. It is available in 2 kg and 4 kg packs, specially crafted to support your cat's well-being and vitality. This recipe isn't just about reducing weight, it's about promoting healthy weight and management. With 34% protein, 11% fat, and 4% fiber, it helps control lean muscle mass while maintaining a healthy weight, ensuring optimal nutrient absorption. Featuring a tantalizing chicken and rice flavor, Ultra Pet ensures that even the picky eaters will enjoy their meals. The vacuum-coated kibbles deliver a taste experience that your cats will love. What sets this weight loss food apart is its formulation made with fresh meat, providing a healthier source of protein. Plus, the added addition of taurine supports good eyesight development and a healthy cardiac activity. With omega-6 and 3 fatty acids, this food promotes a shiny coat and a healthy skin. Additionally, the inclusion of VitaCat ensures essential vitamins and minerals for healthy development and immune system protection. The prebiotics in this formula create an environment for microflora to flourish, further supporting your cat's digestive health. Ultra Pet's special diet, Metabolite, is an ideal choice for overweight cats. Just ask Freya, my Bengal, who has thrived on this diet. Give it a try and see the difference for yourself. Your cats will thank you, and you'll appreciate Ultra Pet's commitment to feline health. Now, back to our episode. So let's give the example of we've supported our client in order to come to terms with the inevitable, and they've gone, okay, they've spent maybe the evening telling the family, last meal.
Yeah.
What are the options available? We can talk from our practice perspective for people wanting to put the animals to sleep, and they're saying, well, like, what now?
Yeah.
What are the options available for them in terms of trying to support what's best for them and their pets?
Yeah. So the norm is people do bring their pets into the practice to be euthanized in a consultation room, or we can accommodate them out in the garden setting as well. But we do also offer house calls that I can come to your home, and we can do it in the peace of your home with family. We can do it in their favorite sunny spot in the garden. Then it's also less stress for the pet that they haven't had to be transported. That is also the case if the animal's not able to get into a vehicle or not being able to be lifted into a vehicle to be brought to the vet practice. So then we are able to accommodate a home visit as well for that. And then it's just, sort of getting the patient prepped for an IV injection. And
so talk us through that process for people who actually want to understand it. I know a lot of people just want to be at the front end, but a lot of people want to understand what is actually going on. What are you doing in terms of, what is the procedure in terms of steps you take?
Yeah.
Whether it's at home or in the practice.
Okay, so first and foremost, it is an intravenous injection that we are giving. So to sort of sum it up, it is an overdose of a very concentrated anesthetic. And we need to give an injection of that into the pet's vein. So first and foremost, we place a soft catheter into the vein and tape it and secure it. And we have an injectable sort of stopper port on the end of that. It's not painful for the pet. It's just a small little pinprick, as if you were getting an injection, but then it's a soft rubber catheter that is indwelling in the vein. It just gives us open venous access that nothing, if the animal were to accidentally jerk away or anything like that, that we don't have a needle in the vein. So that is always first. We prep the patient's leg and get that all sorted.
Probably sometimes the most uncomfortable thing I've found with particularly elderly pets is the tourniquet that we apply in order to raise that vein. Have you found that as well?
Oh, yeah. So that is also case specific. So if we have tender areas, then we don't generally use a tourniquet as such. You are able to hold up a vein or sort of raise a vein with just a bit of thumb pressure over the top of the vein. And if we need to come a bit further down from the elbow, if they've got very painful elbows, we are able to place the catheter further down, or we can even use a different leg. We can also do the top of the paw. It's a bit of a more difficult one to get. Standard is the cephalic vein on the forearm, but we can always try different veins on the body depending on if there's pain associated with a specific area. So then, once the catheter is in place, then that is, I sort of always give the clients, I'm not doing anything at this point yet. You take your time and you let me know when you're ready. So be that at the hospital, in the consultation room, or out in the garden, or at home. Once the clients then give me the go-ahead, I do give them a couple of warnings, which I always think is important as well. So once the concentrated anesthetic starts feeding into the dog or the cat, there can be a couple of body reactions that happen, which are not the animal feeling any pain, but we do get a lot of involuntary muscle movement or muscle memory movement. So it can look like a patient is actually taking a gasp of air, but that is muscle memory in the chest. They do also generally relax the entire body, so you get relaxation of the bladder and relaxation of the bowel as well. So patients can urinate and defecate during the process as well. And I always like to warn about that beforehand, because it can obviously be very traumatic to see if you weren't expecting it, or you think that the patient is suddenly fighting back. That is not the case. They have a very, very peaceful downward transition into a state of sleep, a state of anesthesia, and then cardiac and respiratory arrest takes place, and the patient has passed away without being conscious of anything happening. So always a couple of little warnings in place before I start. And 9 out of 10 times, it is a perfectly peaceful transition. It doesn't happen at every case that they do have these reactions, but just to be aware of it, that it can.
No, this can be quite frightening, even like when they gasp and people are not anticipating that that's going to happen. They think that they're still with you.
It can look terrible. And you can also get muscle fasciculations.
Yes, the trem.
Yes, yeah. And
what about the eyes? Do you warn?
Shame. So, it is always unfortunate. Once the patient has passed away, their eyes are set open, and no amount of closing the eyelids actually keeps the eyes closed. So that is a bit of a fright for the owners as well, that it looks like the patient is just staring into space. And that is definitely something to be aware of, that their eyes do not close, and we unfortunately cannot close the eyes for them. They do stay open.
Yeah. So in terms of you say obviously at home it's a nice environment, but there are limitations in terms of these sorts of things. I think people sometimes don't want their pets to have the stress of coming to the vet. But obviously one of the advantages is the fact that there is more assistance there, sometimes better visualization, if we're being practical here, of things, trying to work in an environment on the floor in the dark, to be able to, get it right.
Correct.
If I'm upfront.
Yes.
The first time without any additional trauma.
Yes.
What if you have a pet that is in severe pain or is likely to bite? What are the options that you give owners if you cannot safely administer a injection in that leg?
Yes.
What are the options there?
So there is the option of intramuscular sedation prior to attempting to put the catheter in. if the patient is quite aggressive, this then might require the owners placing a muzzle on a dog, or wrapping a cat up for us in a towel, just as a sort of the most gentle form of restraint possible for me to be able to administer an intramuscular sedation. That does pose its own risk, though, that if the patient is already compromised, the sedation might also be detrimental to the patient, and that I could actually sort of initiate passing away just by administering the sedation. So that is quite a risky step to take, but in some cases, unfortunately, quite necessary. If I'm not able to get venous access of some point, then I'm not able to perform the procedure correctly, safely, and smoothly. Worst case scenario, if we're not able to achieve this in a home environment, then it would be suggested that the animal will need to be brought into the hospital, where we have more hands on deck, as you say, better lighting, better sort of facilities to
even elevating them sort of on the table can make a big difference.
Exactly.
I mean, I remember sometimes technically how difficult it is to, they position themselves in the corner of a room, and we obviously are very. We try to be very professional about it in terms of, not moving them and not making it any more traumatic for the owners more.
Yes.
So we can read the pets quite well. But we also have to, from a safety perspective, understand that often when we're putting pets to sleep, they are in pain as one of the reasons why we're doing this. And the last thing you want to do is then have an injury to yourself or the owners.
Exactly,
you want that.
And it can, because also certain dogs, they can either be aggressive being brought into the vet practice, or they can be home guarding, and they are actually more aggressive at home than if they were to be brought into the clinic. Sometimes we do even just take the patient away from the owners for a small time frame just to go place that IV catheter, because they might also be overreactive with the owner around. So that is case dependent, and we just advise as best we can in the circumstances that we're in. Obviously, if this is a traumatic euthanasia, or it is during the course of an emergency, unlikely to be doing it at home. That will generally be in a clinic environment. But in those instances, it can just be, unfortunately, a matter of we've just got to whisk the patient away, get the catheter in as quickly as possible, so that the owner does have a few minutes with the patient prior to passing away.
Yeah. I mean, I've found even it does help, and I've put extension lines on them, but it also helps if they're in a hospital environment and you've got a drip up, because that gives you that slight distance if owners want to be. The difficulty obviously if you're going directly into that vein is that you have to be quite on top.
Yes.
But we do take into consideration if there are lots of family members that we can distance ourselves a little bit if that's required, which is a lot more difficult to do potentially in a home environment, but is still an option.
Absolutely.
So if how do you support owners in terms of, other than talking them through the process, what are the sort of things you say to them? You may want to think about doing these things, or we can do these things afterwards, in terms of preparing themselves and making the process less traumatic, but perhaps more sort of a positive memory for them.
Yeah. So once we have euthanized the patient, that there are multiple options available, and sort of very much so from the actual crematorium that we use. And it goes anything from you have the option of burying your pet at home. We do generally ask these questions before euthanasia, so that the plan is in action already, that you're not then having to sort of figure everything out after the fact, because it is obviously a very emotional time. So before euthanizing the patient, which sort of avenue you would like to go down? Would you like to bury the pet at home? If that is the case, we advise on where and how and depth, and taking into consideration other pets at home as well. And then the options of cremation, you can either have a standard cremation where you have no ashes returned to yourself or your family, or you can have ashes returned, individual ashes, so those are genuinely your pet's own ashes and nothing else. And those ashes then can come back in multiple different forms, from a little wooden casket to a photo frame. They do beautiful candle holders that have your ashes, the pet's ashes, swirled in the glass, and even jewelry if that is what you're wanting to do. We do also offer doing paw prints, ink paw prints for clients of their pets. I know I've got my own Dalmatian's paw print is tattooed on my leg. So I like the paw print idea as well, and we do offer that to do for them as well. It's a nice little memory and keepsake to have. And, you know, whether you want to have that framed or painted, there's lots of different options for that as well.
Nice keepsakes.
Yes, yeah. Some people do even request little trimmings of hair, and that can also be, I've seen incredible jewelry made out of hair. It doesn't look like hair at all, but it is the most insanely beautiful pieces of jewelry. So lots of little keepsakes and things that we can do after the fact as well, but definitely a good idea to plan that beforehand, before sort of the huge emotional wave comes through.
And have you, I mean, I know a couple of times we'll have a situation where people say, no, they want the ashes back, and then when it comes time to collecting those ashes, it's sort of reliving that again. A lot of people go like, oh, actually, I don't know if I want to collect them, because it's, you know, it's been 2 weeks. It's not that they've forgotten their pet or that they don't care anymore, but to relive that. But I think in many respects, my advice to them is, if you haven't dealt with that trauma, is to take the opportunity to manage it, because, you know, they made that decision at the time. It's generally one they want to see through.
Yes, no, absolutely. And I mean, we can accommodate that as well. If you're truly not ready to collect the ashes yet, by all means, you know, we can hang on to it a wee while longer. But it definitely, I feel, also assists in closure when you do take those ashes home and you process that the pet is no longer with you. I do think that it offers a lot of closure and sort of finalising that event. You'll never forget your pet. You'll never get over it, and it's not ever going to not be painful thinking of them. But just that form of closure, that chapter is done, and you can then, as they say, sort of lay that pet to rest one way or the other. You either keep the ashes, you can bury the ashes, you can plant a tree on top of the ashes.
Scatter them.
Yes, exactly. It just brings closure.
And what is your feeling on the pets that are at home? You made mention. I mean, I have obviously been in a situation through my own ownership where I haven't been able to bring a pet home. But one thing I've realised is that the other pets at home are very acceptant in the times I've euthanized my pets at home, and actually seeing that body.
Yes.
Is that something that you do discuss with, especially very bonded pets?
Absolutely. For that reason, I do prefer, if people were to ask me, which would you suggest, I do think home euthanasias, if viable, are probably the best with regards to the other pets at home. They do absolutely have a sense of when their friend has passed. So if they have that opportunity to just be around the body, I do feel that it helps their grieving process a lot, in the sense that, yes, pets do grieve. They do miss their friends, and it is sometimes quite difficult for them to understand if the friend has just gone in the car and has never come back. And, you know, that grieving process for pets can take up to 3 months for them to sort of get back into normal routine again as well. And I definitely see that is shortened and they cope better. Yes, they are still grieving their little friend, but you can definitely see that
they're a lot more acceptant, aren't
absolutely,
they?
Yeah. And the behaviour is interesting to watch as well. I see it quite often where they do walk up to the body and they'll sort of have a little sniff or a little look around, and you'll actually see them sort of just
understand.
Taking a step back, and that little friend is deceased. They know. They absolutely know. Yeah. So, it doesn't mean that they're not going to miss them, but I certainly advise that it does help the grieving process a lot if they're able to see.
And obviously the ones that are potentially struggling, how do you support the other pets at home if they never return? I mean, what is the kind of thing that you advise in terms of managing that?
It can be difficult, but at the end of the day, you just got to understand that they do have their own grieving process, and there is no set time. It is a sort of a blanket time frame of about 3 months. That it can take for them to get over the loss of their friend. So just ensure that, their daily routine is not upset too much if possible. Keep going with what you normally do. I want to say sort of, yes, do spend more time with them. Do give them a little bit of TLC, extra TLC, in the sense that they are grieving, but also not to go overboard if you're not going to be able to keep up with this going forward, because then you might actually start creating separation anxiety after the fact. So if you've now suddenly started taking the pet out every couple of hours for a nice long walk and sleeping on your bed and, encouraging all of this behavior in that grieving time frame, but then after the fact you're not planning on keeping up with that, that might upset the apple cart again going forward.
Yeah. A lot of adjustments.
Yes, yeah. So try and keep to your routine as best as possible, but obviously, a little bit of extra attention and understanding that they might not stick to their routine initially, but do try and keep everything as normal as possible and support them through it that way without going too overboard.
Yeah. Now, I want to get a little bit more controversial, and I want to take the opportunity to discuss the difficult times when you're either faced with an owner who's leaving the country, can't take their pets, having to relocate maybe for whatever personal reasons into a property that doesn't accommodate their pets, or they're faced with something difficult like the dog has bitten someone. Yeah. And they're not old, they're not sick. They haven't had a major accident. It's tough.
It is very tough. And unfortunately, it is also just, it's reality at this point. We've got a lot of people immigrating. We've got a lot of accidents happening. And the unfortunate reality that goes with it as well is that there are also just so many animals, homeless animals, pets that can't immigrate with owners for whatever reason. I mean, the finances associated with that is astronomical. So for you and your family to move overseas is already a huge expense. To then, to financially accommodate pets is not always possible. And I can guarantee those people, if it cost R2 to get their dog from here to Australia, they would absolutely do that. But it does not cost R2. It is a huge financial burden, and the point of you emigrating is to probably set up a new life in another country. You're also going to need finances on the other side to start your new life, because not everything falls into place. So from that point of view, I want to say, that there shouldn't be any judgment on those people. I don't want to judge you for your decisions. And at the end of the day, like I've sort of bounced from the animals that are in welfare or rescue organisations, there are so many of them already. To then put the burden on those guys as well by then putting those animals into rescue, if you're not able to take them with you, you're now adding to the already overflowing kennels of then hoping that your animal gets rehomed at some point. Your animal is then not going to understand why on earth their family just left them. They're now stuck in a kennel. I've never been in a kennel in my life. It is very stressful for that animal. So from that point of view, I think it is actually kinder to let that animal slip away peacefully with their family present, and they have not gone through any grief, trauma, and abandonment or feeling abandoned. So that sort of covers that immigration side. The same goes with animals that have, behavioural issues, cannot fit into certain households. People are moving into complexes. Some dogs aren't suited to complex living. Either the garden is too small, or complexes are in general quite busy little communities, and they might be excessive barkers. They're not welcome. They might not be the right size category. And at the end of the day, there are also certain circumstances where the people can't help but move into these places for whatever reason. Old age homes won't accept a large, boisterous German Shepherd. And circumstances like that arise aren't always planned 4 years in advance. When you got the German Shepherd 4 years ago, certain things happen that weren't expected, weren't planned for, and now you're in a situation where you've got this animal and it doesn't fit into what needs to happen or what's going forward. And that is, I feel the same sort of feeling comes for that animal, if it's a very social animal, very happy, slots into anything, and you are able to secure a great home for that pet, great. But that is unfortunately a minority. And I then again say, rather than putting that animal into a shelter situation, hoping at some point it gets homed, animals can sit in shelters for years. Some shelters have rules that after 1 year they get put down anyway, so now your animal has just been through a year of sitting in a cage with no family, no one around them. The rescue organisations do the best they can to love and cuddle and everything, but there are limitations as well. So rather than putting that animal through that situation, be with your family and drift off to sleep. And as sad as that is, nobody wants to put their animal down at a young age or a healthy pet, but I would far prefer being put to sleep peacefully, knowing I was loved with my family, than being abandoned somewhere and I have no idea what's going on. And they don't understand why you've just left.
No.
Yeah.
No,
So I think it's far more dignified for those pets.
I agree.
Yeah.
And I think people, before they comment, need to understand that there's often more to stories.
Exactly. Yeah. Don't judge.
No.
This world is difficult enough as it is. And
rather support and actually view people
yeah.
with what they have as great intentions, but
Yeah,
just not always
exactly.
the ability or capability.
Circumstances change.
Absolutely.
I had a very sad case just a couple of days ago where a family member, sort of the breadwinner of the family, had passed away unexpectedly at a young age. And there were multiple pets and there were children, and finances were now suddenly all up in arms, and they had to sell up their house and move, and the pets couldn't go with. And, you can't judge those people for making that decision. That is something so unexpected has happened, and the life as they knew it has completely changed. It is, and changed forever. And, they had to make an incredibly tough decision for the well-being of those pets, in the sense that they can't be rehomed, they can't go anywhere else. The one is a diabetic, the other one's got pancreatitis. You can't just sort of like, oh, well, somebody else must take care of them now.
Yeah.
So they've done right by those pets, that they're not going to be shunted all over the place. They're still in their current home, peacefully put to sleep. And I think that is the best case for those pets.
Yeah, I agree.
And sorry, I just want to mention one other thing that I just actually happened to bring up the other day. These are old statistics for South Africa, but I think it's probably actually worse now. But with regards to the number of animals in shelters and people adding animals to shelters, for every single pet in South Africa to have a home, every single person in every single household has to own a minimum of 27 animals and to clear our shelters. There is not a snowball's chance of that happening, ever. So to add to that extraordinary number of homeless animals is, in my opinion, also irresponsible at times. So, unless you can find 27 pets a home with your uncle and your aunt and your sister and your brother, and every single one of you has to take on 27 animals, at that point you can then maybe judge somebody for putting an animal to sleep.
So in terms of that, the actual reality is my sort of parting question to you. People always say, I don't know how you do your job. Putting animals to sleep must just be the worst. And obviously, you probably know where I'm going with this, because we know that is not the worst thing that we do.
Yeah.
I think, from our perspective, yes, it's really emotional. We often, if there are patients, we cry with the owners.
Yes.
I mean, I know I do.
No, I have many times before.
We come out and then you carry on with your day and you go into your next consult to do, something where you've got to be upbeat and really in the moment.
It's a puppy vaccination.
Yes. But let's have your final thoughts. Just, what do you say when people say, oh, the hardest part of your job must be to put animals to sleep?
So, yes, it's not the hardest part. There can be very difficult times and, you can get quite emotionally attached to certain patients. You might have worked with them for years, or it's been a long haul of medical treatment and it's just not worked. And it's now time to say goodbye to that patient. It can be very emotionally taxing on us as well. We do care for your pets like our own. So at some points it does feel like we've just lost a chunk of our heart as well. And but it can absolutely get worse than that. The worst part of the job is not being able to either giving a pet a dignified passing and, sort of this patient leaving the practice to go and battle at home, or to, it must die of its own accord at home. In the meantime, it's dehydrated, it's collapsing, it's in excruciating pain, and there's nothing that we can do for those pets, in the sense that the owners have declined treatment or declined euthanasia. That is the hardest part, is watching those patients leave, and there's nothing that we can do for them. That's the hardest part.
I agree with you.
Yeah. Euthanasia is a very, very gentle procedure, and it's a dignified passing with generally family and loved ones surrounding them.
Absolutely.
So, yes, it's emotional, but it's not the worst part of the job.
Thank you. Thank you for sharing your experiences and taking us through the process. And I mean, there's just been so much we can continue to talk about and case examples. But I think hopefully that has given our listeners some comfort and some more information on sort of how to best handle it when they're faced with it. Or
it's always a difficult decision, but it's a necessary one. And there are fates worse than death.
And thank you for all you do for your patients.
Anytime.
Sister Kat. Thank you. Thanks. Thank you so much for tuning into today's episode on the Pause and Effect podcast. If you found the discussion helpful, please like, share, and follow our podcast. Don't forget to leave us a comment or review. We love hearing from our listeners. Remember, you can listen to us on your preferred podcast platform.
We have an exciting announcement to make. We are looking for guest speakers who are passionate about the pet industry and sponsors to support future episodes. Are you an expert in pet training, nutrition, or behavior? Maybe you're a veterinarian with insights to share, a pet store owner with unique experiences, or a pet product inventor. We want to hear from you. The Pause and Effect podcast is a platform for industry professionals like you to showcase your knowledge, experiences, and stories. As a guest speaker on our podcast, you'll have the opportunity to share valuable information, engage with our audience, and have your voice heard in the pet community. Whether you want to discuss training techniques, emerging pet care trends, or the importance of mental stimulation for pets, we want to feature you and your expertise. So, if you're passionate about pets and have something to say, we invite you to join us on an upcoming episode of the Pause and Effect podcast. But wait, that's not all. The Pause and Effect podcast is also seeking sponsors to support our mission of educating and entertaining pet lovers worldwide. By becoming a sponsor, you'll gain exposure to our engaged audience and have your brand associated with the love and care that we have for our four-legged friends. If you own a pet-related business, offer pet products or services, or simply want to align your brand with our pet-loving community, we'd love to partner with you. As a sponsor, your brand will be featured prominently in our episodes and our social media channels. It is a great opportunity to showcase your offerings to a dedicated audience of pet enthusiasts. So whether you're an expert in the pet industry looking to share your knowledge, or a business seeking to reach a pet-loving audience, we want to hear from you. To apply as a guest or to inquire about becoming a sponsor of the Pause and Effect podcast, please contact me at Dr. Carra at pauseandeffect.co.za. Get in touch and let's discuss the various opportunities. Thank you for joining us today. We can't wait to welcome our future guest speakers and sponsors to the Pause and Effect podcast. Remember, every episode is an opportunity to celebrate our four-legged friends.